When I see a patient, I like to try to spend extra time. And I think that makes the doctor-patient relationship different in the sense of the way we were trained years ago. We were taught to spend a lot of time really getting to know the patient. And I like to do that as well. So I'll spend at least 1 hour with a new patient. Why? I need to get to know you, your lifestyle, what your work activities are, your sports activities are, and get a feel for your goals and examining you, of course. Through all that, and then reviewing films, studies, and combining that, we want to make a plan. And you and I make the plan together. And I don't think with spine care, a 10 or 15 minute consultation really adequately gives you the chance to understand what's going on with your spine. So I'd like to spend at least an hour.